thanks to our best-in-class vaccine programme and our best-in-class testing and tracing service, and the hard work and sacrifices and cooperation of the Irish people, the Government today was in a position to approve a roadmap to ease almost all restrictions on a phased basis between now and October 22nd, starting on the 6th of September, with events and mass gatherings, moving to the 20th of September with the return to the office beginning, and also indoor and outdoor group activities being allowed, and on the 22nd of October, the remaining restrictions on social activities, nightclubs and hospitality being eased. I think, though, we shouldn't see October 22nd as some sort of freedom day. Rather, we should see it as the first day of the new normal. We'll be able to return to our offices, but I think for the majority of people, blended working will be the new normal, working sometimes from home, sometimes from the office, and sometimes from a remote hub. We'll still wear masks on public transport, in healthcare settings, and in shops, and anywhere where you feel it's safer for you to do so. If we get sick and have respiratory symptoms, we'll still be expected to isolate ourselves, to get a test, to observe respiratory etiquette and hygiene, to wash our hands and cough into our elbow. Restrictions on foreign travel will remain in place, similar to those that exist now. We'll have a vaccine booster programme because there is growing and clear evidence that immunity from the vaccines does wear off, and immunity from the mRNA vaccines wears off quickest. And also, ventilation, regular cleaning and spacing will be part of the new normal. To businesses and to workers, I'd say the following. First of all, thank you for your forbearance to date. For those businesses that are still shuttered, that are still closed, you now have a date for reopening. And we want to do everything we can to make sure that you reopen safely. For those workers who've been unable to return to your jobs, you now have a date as to when you can. The CRSS payment will continue to be paid to businesses that are closed every week until they're allowed to open, with the 3-week bullet payment for those reopening for the first time. The employment wage subsidy scheme will remain in place until the end of the year, and a decision will be made on budget day in about 6 weeks' time as to whether we need to extend it into next year as well. And it is acknowledged across government that there are certain sectors hit particularly hard, like the arts entertainment sector and the hospitality sector, that will need additional financial and government support through into 2022. The easing restrictions on September 6th and September 20th will go ahead as announced today. The easing restrictions on October 22nd, in line with public health advice, will be subject to an assessment done the week before. People may ask why October 22nd, and the reason for that date is twofold. It's the point at which we are confident that 90% of the population over 16 will be fully vaccinated, or at least something very close to 90%. And it's also when the models tell us that we'll be past the peak of the Delta wave. We do not believe we're past that peak yet. So if we do not ease restrictions then, the question is when? And if not then, why ever? In terms of the return to the office, this will be done on a phased basis, and through the LEAF mechanism, we'll be discussing with business organisations and trade unions a revised protocol on working safely and returning to work safely, giving advice to businesses and to employers as to how they can return to the office in a phased way. But there will be flexibility as well, because every business is different. I finish with a word of caution. This pandemic is definitely not over. I've always said that we need to get through at least another winter before we can safely say that it is behind us. And we're heading into that winter over the next few months. And as the Taoiseach said in his speech earlier, that could be a difficult winter in our hospitals. We see in Israel record cases being recorded today and deaths rising. And that is a country that was ahead of the curve in terms of vaccination. It didn't reach as high levels of vaccinations as we have, but was an early leader in terms of vaccination. And the evidence from there is very clear that vaccination immunity wanes. And that's why the booster programme is going to be so important in the autumn. We see in the United States, where many people are not vaccinated, hospitalisation rates are now soaring and may actually go higher than they did in the last wave. And the European Union today decided that people travelling from the US are no longer considered safe when entering the Schengen area. And in Australia and New Zealand, most of those countries are in lockdown, in the case of Sydney, for nearly 2 months now, because of the transmissibility of the Delta wave and very low levels of vaccination in those two countries. In Scotland, cases are soaring again. They're having a second spike in the Delta wave. That cannot be ruled out here. And in England, cases are rising again, albeit less rapidly. So that does tell us that this pandemic is far from over yet, unfortunately. And has always been the case from the beginning. We've had to balance three things. The need to put public health first, protecting people's lives and people's health. The need to consider the protection of the economy and people's jobs and livelihoods. And also the need to protect and preserve people's personal freedoms. And we've always had to make decisions trying to balance those three factors. But if we have to act to put public health first again, then we will certainly do that.
Eamon.
Thanks very much indeed. We met through August, since our last Cabinet meeting, with a series of COVID subcommittee meetings, and throughout that, paying real attention to what our health advisors were saying in terms of what was happening with the vaccine. There was about 800,000 additional vaccines in August, 1 million in July. Game-changing in terms of hospitalisation and case numbers, what's happening internationally. We also have to take into account some wider considerations, including real broader maybe health considerations, mental health, well-being, spirit of the people across the country. And for that reason, we're continuing with the process we started earlier in the summer, late spring, of this gradual phased reopening. It's going to require a lot of trust and we're absolute confidence in leadership right across our country in a whole range of different institutions. Returning for the office, every office will be different. And the employers and unions and workers are going to have to work together to work how much hybrid, how gradually. It's not going to be instantaneous, but that'll be a local decision. That'll be something where people work in teams in their own employment, in their own office, to make that work well. We'll facilitate it by the return of public transport tomorrow. That also with the return of college, return of schools, we need our public transport system back. One clear message we need to get out though, still wear your mask in public transport. I was asked earlier on today about it, I said that's the way we roll. We show respect to other people on the bus and on the train, but it's also the law. You have to wear a mask in retail, in health settings and on public transport. You've got to keep the windows open. We've got to be careful still. There's still high incidence and we try to avoid it spiking, even though we, as Taoiseach said earlier on, we are likely to see further increase according to the modelling. So this is not over. We have to protect ourselves and show leadership, each of us, in how we do this. I think the return to college is one of the most important elements because for the mental health of our young people, that idea of a university revolves around collegiality. Listening to Simon Harris today say three things about that. Immediately, we're starting to see the small classes, tutorials, workshops coming straight back. The social end in college, and that's important, is going to operate under the same rules that apply in the rest of society. So it'll be up to colleges, college societies, student unions. They can work out how exactly we apply these broad guidelines that we're initiating today so that there is a social life in our colleges. And thirdly then, return to lectures. And again, what I heard Simon saying today is each college is going to have to decide. Each lecture hall is different. So you have to work out exactly what numbers, how you do it. And hopefully as we come into the middle end of October, 22nd of October, we get the lecture theatres fully open. We're also going to really rely on our community organisations, our community leaderships. Now whether that's bridge, bingo or basketball, every community centre, we're going to start to see things coming back. And again, managing that in a safe way, keeping to the good protocols, making sure there's ventilation if we're indoors, trying to do as much as possible still outdoors. Our community organisations will be able to do that. But we do need to come back for fitness, for the very mental health benefits that it all brings. Thirdly, I'm really proud that my colleague Catherine Martin has been really representing, pushing the case to get our arts communities back. And that's important for their livelihood, for the need for us to tell stories to each other and be inspired, and also because that is what we have to do. We have to get back and manage living with COVID. I'm also very glad that we're going to see our churches return to more normal services to lift our spirits. And again there, it's simple guidelines. We're not going into complex, detailed, huge rules that are going to be difficult to apply. Our churches have been really good at organising during COVID, making sure that people have stayed safe, still wearing masks. And that's going to stay the same. But that simple rule, 50% of the church size as a congregation, be that a funeral or a christening or other events, Sunday Mass, whatever. I think that's the sort of way we want to make this work in this interregnum period, is not to make it overly complex, to allow our local community leaders right across, be that in business, in colleges, in churches, in community centres, that they'll be able to manage this transition and keep ourselves safe. Thank you.
Thanks, Eamon. We'll take questions.
Good evening to you all. Two brief questions, if I may. Firstly, just on the continued use of face masks. You've outlined the three sectors, Taoiseach, in which you expect them to still be used. You'll know that there is some nervousness around the return to school, which is kicking off last week in this. Is it still expected beyond October the 22nd that secondary pupils will still be expected to wear face masks in school, and likewise then at third level and onwards, or is that a case of guidance versus law? So you might address that, please. And secondly, just also on the expansion of events like sports attendances, which you've outlined, could rise to 75% as of next Monday. You'll know from the legislation that was passed just before the summer recess that the vaccine certificate cannot be applied to an outdoor setting. So can you explain how exactly you'd intend that there could be a distinction between 75% if everyone is vaccinated or recovered versus 50% if they're not, or how exactly that will apply in practice, please?
Yeah, the first one, the statutory obligation to wear masks will still continue after the 22nd of October for those three areas of healthcare, the public transport, and in terms of public health transport and retail. In terms of education, it's always been subject to review. It will continue to be subject to review in terms of second level, and indeed HSPC are looking at it in terms of some aspects of primary. So that will be subject to review, okay, and will not be done on a statutory basis. We do not intend to bring in legislation in terms of the application of the vaccine cert for outdoor activities. That will be down to the operator of any particular event or the organiser of any particular event in terms of ensuring that that remains the case. The guidance in respect of children as applies to indoor hospitality will also apply to such events in terms of matches and so on like that.
Sorry for a follow-up. Does that not mean then you have a situation where, for example, a sports governing body could decide to have 3/4 of their venue capacity without actually applying any kind of vaccine distinction because there's no legal basis in which to do so?
No, they will have to. It'll be up to them to apply it in good faith. We're moving out of the regulatory phase. We never intended, let's be honest, in terms of legislation for outdoor utilisation of the COVID vaccination cert. The debate in the Dáil was quite contentious just before the recess. We do take debates seriously. People articulated views in respect of it, and given the timelines involved here, there clearly will not. There's no sort of intention of government or plan of government to bring in legislation for outdoor application of that. It's in good faith.
The first one for the Taoiseach, please. The 11:30 curfew on hospitality businesses, when is that likely to end? And then for the Taoiseach, we see wedding bands being allowed to return to business next week. Does that mean dance floors are back open? Will people be allowed to dance at weddings?
Well, the legal requirement in relation to dancing will be removed, or the legal prohibition, the regulation will be removed. The public health advice will still prevail in terms of the public health advice in respect of the gatherings and so on like that, and dancing and so on. But I think there will have to be practical application of that on the ground.
Yeah, so for the hospitality sector, the 11:30 closing rule and the 6 to the table rule remains in place until the 22nd of October. But from the 22nd of October, all things going to plan, it's back to the status quo ante in hospitality and back to the old rules, if you like, the pre-pandemic rules in terms of closing times and numbers of tables.
Taoiseach, could I just ask you about the question of the return to work? And to what extent is this effectively, by devolving power down to individual companies to decide, is the government walking away from giving a lead on this issue? Should you be more explicit about what is going to be required and what they're supposed to do? And Eamon Ryan, if I could ask you, please, Minister, just on the question of enforcement, you're saying that these masks are going to remain on public transport. Is there going to be enforcement measures? Will there continue to be? Will that actually happen, or is that going to fade away? Thank you.
I think one of the things that's worked quite well in the pandemic is the Labour Employer Economic Forum, this mechanism by which government engages in a structured way with trade unions and employer representative bodies, and that's how we developed the first return to work safety programme and more recently the work safely protocols. So it's intended that talking to the unions and talking to employer bodies, we will now revise those protocols with advice on how businesses should return to the office in a phased way. If you look at what's in the existing Living with COVID plan, it says that the first phase will be returning for training, for induction and for meetings, and the second phase would be at about 25% occupancy. But we don't want to prescribe that here today. That's the kind of plan that's on the shelf, if you like, but between now and the 20th of September we're going to sit down with the unions, sit down with employers and revise that protocol so that there is guidance on how you can phase people back into the office. But we also want flexibility too, because every office is different, every business is different. As I said before, I don't see things going back to the way they were before. And one of the things that I think is going to be a permanent change post-pandemic is the workplace. And most people, I hope, if they want it, are going to embrace blended working, where sometimes you're in HQ, sometimes you're working from home, sometimes you're working from a remote hub, maybe in a rural town or village. And that's the new normal, if you like, that we think makes sense, not just from public health point of view, but also from economic terms and in terms of quality of life. And we'd really encourage companies and employers that haven't had that conversation yet with their workforce to do that now, because there's a date, and that date is the 20th of September.
And Paul, yes, the same enforcement mechanisms that are in place at the moment in public transport or in retail or in healthcare centres will be there through this period, and they have worked. Both the guards and transport operators, while it's been difficult, it has worked. But the main reason it's worked is also because the Irish people have wanted to see it work. Right from day one, when we introduced the restrictions on public transport, there was an incredible turnaround, and we've seen that in this country. The way we have actually topped the international league pretty much in vaccine uptake, and the way we have actually adhered in mask wearing, it's an inconvenience, but on a bus journey or on a train journey, it's an inconvenience I think most people are willing to continue with, and it's out of respect to other people as well as one's own personal health.
Taoiseach, can I just get clarity on follow up on Adam's question there about the dancing issue? You said that was going to be lifted. Is that on the 6th along with the live events? Is that correct?
The regulation pertaining to dancing, will be removed from the 6th onwards.
6th onwards, great. And Taoiseach, sorry, just on the issue of returning to work. So we're currently have a situation, I suppose, where managers are finding themselves on shaky legal ground in terms of asking their employees' vaccination status. Experts have said that even deploying unvaccinated people to different sectors of the company could leave them vulnerable to allegations of discrimination. So you have said that the work protocol will be looked at. Will that new safety protocol, our government give advice on that, or where do we stand?
Yeah, as I say, the work safety protocol will be updated between now and the 20th of September, and we will have that discussion with the unions and the employer bodies before that. I think it unlikely that we will give employers the right to know, if you like, whether their employee is vaccinated or not. I think that would be a very significant invasion of people's personal privacy. They can volunteer the information, of course, but that's a very different thing to requiring them to give that kind of information to their employer. If we make any exceptions, I think it would only be where people are working with, with very vulnerable people, perhaps in nursing homes and healthcare settings. But I don't see that changing very much.
And just to follow up there on what you were saying about watching other countries closely, like Scotland and Northern Ireland, and you were mentioning some other countries there as well. But what exactly are you looking at in terms of trends, and what sort of preparations are we putting in place to deal with any sort of surges, and what kind of data or increase in cases or numbers would put the 22nd of October in jeopardy, in your opinion?
Yeah, well, I guess I spent nearly 2 years watching other countries and trying to work out why some are doing better than others, and there's all sorts of theories why, and but the evidence is all over the place, and often it's just timing. We can see the Delta wave is moving across Europe from west to east. Why they peaked sooner and got it under control so much quicker in the Netherlands and Portugal versus Ireland, I don't know, and people will write books on this and papers on this, I'm sure, for months and years. It's very hard to know, why any country is doing better than another at any particular point in time. And often the country that's doing worst in the world within weeks is doing best, and the country that's doing best in the world within weeks is doing worst. There's still so much we just don't understand about this virus and this pandemic. And there's also some of it is just randomness and luck and bad luck in some cases. But what's there in the plan that's being published today is that when we do the assessment in the week before the October 22nd, what we want to know has been achieved is 90% or close to 90% of people over 16 fully vaccinated. The HSE and Professor McGrath says to us that we can't really do much better than that. That's as good as we're going to get in terms of vaccine protection. And also we're going to want to see that the incidence of the virus is stable or falling, that we've passed the peak of the Delta wave. And I suppose, if we're not opening up in that scenario, when we're as good as it gets in terms of vaccine protection, when we're past the peak of the Delta wave, well then when would you open up? And we think that's the best point, and that's guided very much by the public health advice. What's there, you'll see in the NEFID letter as well, is of course there are caveats. If there's a new variant that we're very concerned about, that could change the picture too. Or if, for example, we were in a very serious situation in terms of capacity in our health service. Hospitals are always busy, and ICUs are almost full, particularly in October, November. I don't mean that. But if we were facing, very serious situations in our hospitals, again, I think that would affect the assessment too.
Gabia Gatavitskaita with the Irish Independent. Just going to have two questions for the Taoiseach and two for the Taoiseach, if that's all right. In regards to the 60% capacity for vaccinated for indoors, will that apply to pubs and restaurants if they have live music? Obviously, then they might have to reduce their capacity. And can I also ask about maternity restrictions? We've heard a lot of talk about this in recent weeks. Even if hospitals have said that, or certainly, even if ministers have said that maternity restrictions should be gone, that's not happening in practice. And then just the Taoiseach, just in regards to your Deputy Leader Simon Coveney, he's revealed that he was invited to the Marion Hotel party despite his spokesperson previously saying that he only learned about it from media reports. Are you concerned to hear that? And do you still have the text messages between yourself and your Deputy Leader in the days before the Marion Hotel party? And are you concerned that Minister Coveney has deleted your texts to you?
Could I just say, first of all, in terms of the 60% relates to from the 6th of September, the organised indoor and outdoor events and mass gatherings. That's not intended to apply to indoor hospitality. There's already existing guidance in respect of indoor hospitality. And your second question was in respect of maternity. The HSE have developed new guidelines in respect of access for partners to maternity warding, and those will issue imminently. I think they're with the Department of Health right now. So our intention is, and the commitment from the Health Service Executive is to have as open access as possible. And as in line with, it'll be imminent. It's my understanding next number of days that those new guidelines will issue.
I have to say, I have to check, but I don't recall having any text message conversation with Simon Coveney in relation to the the gathering at the Marion Hotel. So I don't think there were any to delete, but I'd have to look back as to what he said exactly. And as I said before, I wasn't involved in organising the event or issuing invitations or anything like that. I was there for about 40 minutes. It was outdoors. It was a speech and refreshments, no meal, no music, no entertainment, no mingling between the tables, and was in line with government regulations. And at least while I was there for that 40-minute period, the only Oireachtas members present were me and Deputy Vacik. Everyone else would have been, I suppose, former staff of the Department of Children or people from children's NGOs or equality campaigners, feminists and so on.
Are you concerned that his spokesman said that he wasn't invited a couple of weeks ago, and actually today as a Commission for Foreign Affairs, Mr. Curfew did receive a text?
Yeah, I honestly can't speak for the Taoiseach, having not heard, I can't speak for Mr. Covey, but having not heard exactly what he said, I honestly can't answer that.
Taoiseach, just to follow up on Gabby's question on maternity restrictions, a lot of people will look at what has been announced today, and they will obviously be glad to be able to go to indoor events, or they might be happy for indoor sports to reopen. But a lot of people will look at it and say they're still being denied access to visiting or to accompany their partners to scans. Birthing partners are still having to wait in car parks. I know you said that the HSE is issuing guidance. Will the government impress upon individual hospitals that that guidance needs to be followed and should be followed within the public health advice? And then one for the Taoiseach, for employees who aren't comfortable going back to work from September 20th, what is their legal recourse? Where do they stand if an employer asks them to return to the office from the 20th and they don't feel comfortable, either because they have reservations about the spread of the Delta wave, or that they might have contact with somebody who can't get vaccinated and is vulnerable?
Could I first of all say, guidance has already issued. Government is very clear to the leadership of the HSE. Minister Donnelly has been very clear that there should be access to scans and also to the labour ward itself. Now, you know and I know clinical autonomy has always prevailed in respect of certain settings, and in certain settings there have been challenges in terms of public health protection. That said, given that we are close to 90% vaccination, in our view there should be access, and updated guidance will issue from the Department of Health in respect of that. From a political leadership perspective, we're very clear and unanimous on that front.
Yeah, look, that's a fair question, and I can understand that there may be some people who have been working from home for a very long time now, and perhaps are reluctant to return to the office or return to the workplace. But bear in mind, since this pandemic began, there have been lots of people who have been going into work every day. Bus drivers, people working in retail, people working in healthcare, people working in security, Gardaí. They've never been able to say that I don't feel comfortable driving that bus, or I don't feel comfortable working in that supermarket. And I don't think it'd be reasonable now to say to people who've been working from home that somehow you don't have to go back to work because you don't feel comfortable. I don't think that would be reasonable or respectful to all those people who were going in to work every day. So the position is that if you've signed an employment contract, you have to honour it.
I think the sense is, if I may, that we're getting back from employers, and this will be a very phased return. There is no sense that there's going to be a collective one-off sort of return to work on the one day. The sense will be that it will be phased and over time, and that there will be a blended dimension to quite a number of enterprises.
And lastly, even in the long run, I think we can expect real change. We will see a lot of more remote working compared to the past, hybrid arrangements. And I think that's why I come back to what I was saying earlier on. This has to be worked out in each individual case. It's that contract between the employer and the employee. It'll be very different, I think, but there isn't a government setting an absolute caveat, you exactly this or exactly the other. It has to be each circumstance.
You're in from News Talk. Can I just get clarity on weddings? Will the head count at weddings increase from 100 over the coming weeks, or will it now be considered an indoor event and be subject to the 60%?
No, it's staying. The wedding is staying at 100. Yeah.
Staying at 100.
Yeah.
Okay. So then,
as we say, on the 20th then of October, all remaining restrictions or removed.
So if you had a wedding on the 23rd of October, you could have as many as you like in theory.
So firstly, a question to the Taoiseach. You said that face masks for primary children is subject to review. Given that schools are back now, surely shouldn't that review be done already and that advice be implemented? And do you believe that primary school age children should wear face masks? And then one for the Taoiseach as well. Where does the, with the return to office, where do employers stand in terms of wearing masks, with enforcing that with employees? Will employees have to wear masks at their desk if they can't adhere to the 1 metre, 2 metre social distancing rule?
First of all, in terms of education, there has been ongoing consultation between public health authorities, the Minister of Education and the Department of Education right throughout the summer in respect of all aspects of the return to school protocols, including mask wearing, in respect of both post-primary and primary, in respect of CO2 monitors, ventilation, and all the other dimensions of a safe return to school. And it is subject to review right up to the opening of schools, to the day of opening of schools or the week of the opening, because obviously those in public health observe what's happening elsewhere in terms of impact of school openings potentially on the rise of the Delta variant in particular, because as the Chief Medical Officer would have said to us, we've never done school opening in the context of such a highly transmissible variant. So it will be under constant review. And what was announced, what has been announced prior to the opening of schools was the outcome of that engagement with public health. That doesn't mean that in a week or two or in the next number of weeks, changes can occur in terms of that ongoing review of how it's working and so on.
Yeah, the law at the moment requires that masks be worn in certain workplaces, but from the 22nd of October, that will only apply to public transport, to retail, and also to one other one.
Public transport, retail,
public transport, yeah, and healthcare settings. In the interim, I'd have to double check this. In the interim, I think the position is that you don't have to wear a mask in the office, but if it's a crowded space or if people are walking around, it's advised that you do. So if you're sitting behind a desk, you don't have to. Or if you're in an office on your own, you don't have to. But if you're in kind of a crowded office space, sharing it with a number of people, or if you're walking around, or if you're going to the kitchen area, the canteen, it's advised that you do, but I don't think that's the actual law at the moment.
October 22nd, people won't have to wear masks in work.
No, that's correct. So the only place there's only 3 places where you'll be legally required to, and that is public transport, retail and healthcare, and I imagine that will include airports and train stations and so on. However, what we will be saying to people is that perhaps it makes sense for you to choose to wear a mask in certain settings. Certainly for me, I think in a crowded setting, I think that'd be a setting where you might decide to wear a mask indoors. Maybe not always, but sometimes. And I know for decades, it's been very much part of Asian culture that when you have symptoms or you feel that you might have some symptoms, that you wear a mask. And I know for years we'd often see people in Asian countries wearing masks, and it felt a bit strange to us, and now looking back, it actually was quite a sensible thing to do because they were doing it to protect others. And I think that's probably going to become part of our culture. I wouldn't be surprised if seeing people wearing masks in the winter becomes quite a common sight in Ireland and European cities, because the mask doesn't just protect you from COVID, it can protect you from all those other respiratory viruses which are likely to make a comeback this winter, RSV and flu and all of those.
One other important public health message caveat to add to that. If anyone ever feels any slightest sense that they may be infected, that they have any sort of symptom, or that they're in a situation where there's a risk, they have to get tested straight away. They have to isolate. It takes 3.5 minutes in these walk-in centres to get tested. It's going to be really important as we manage this that we keep our testing system up and that people don't let the guard down. Anyone who's in any way thinks that they might be at risk should be tested and should self-isolate straight away.
I think the key point at a higher level is the question you're asking really comes to the core change. That we essentially are moving from a regulatory phase to one where personal judgment will be exercised. after the 20th of October. That is the significant move that's underway really over the next number of weeks. So culturally, that will take a bit of getting used to, given what we've been through. But that is the intention and that's the approach that we're moving towards.
For employers that aren't in those 3 settings, will they still be able to ask their employees to wear masks if they feel they want to?
Ask yes, but it won't be a criminal offence not to.
Hi, Ciara Phelan from the Irish Daily Mirror. Just some clarity. Taoiseach, you mentioned that dancing, the legal requirement for dancing, so basically people can go back to dance floors at weddings and stuff. I know what you're thinking. Regarding nightclubs, I'll get to that one.
What am I thinking?
Can get back dancing
I think
from...
there's some song, Shall We Dance? Or
Rock the Boat. From September 6th. But Taoiseach...
Sorry? Yeah, you're saying... Yeah.
Sorry, just the legal requirement to dance again from September 6th. But Taoiseach, you mentioned that it would be October 22nd before, where the 6 at a table rule would be lifted. So... Can I just get a bit of clarity on that? Are people allowed, dance back in pubs from September 6th when they're inside if music is permitted? And then just on to, will full capacity at nightclubs be permitted from October 22nd, all going to plan? And the same applies to indoor capacity at gigs, like at the 3 Arena, will it be full capacity? And then finally, Taoiseach, just on a personal level, what has it been like for you today to announce what appears to be the exit roadmap out of COVID? Thanks.
Well, first of all, on the dance, okay, we're removing the regulatory prohibition on dance, but the public health advice still prevails. I can't change public health advice, nor do I ever intend to. And I think people have to take on board the advice and the guidance from public health in respect of what may be a factor in causing the spread of the disease. But we do believe removing that sort of regulatory, if you like, prohibition on dance should happen, and that's the government have decided to do that. And just on a, when I say on a personal level, I think from the government generally, we have consistent, I think since the difficulty in springtime, I think we said we would cautiously reopen society. I think we've done that to date relatively successfully and effectively. And as we open one sector, the next sector is very hungry to be reopened. I understand that fully. So on a personal level, one is very hopeful and happy to be able to sort of say to a lot of groups, particularly I'm very conscious of young people, for example, who haven't been able to go to singing lessons, dance lessons, swimming lessons, indoor sports, for example, has been prohibited for a long, long time. So I'm very pleased for them, for that cohort of people. But equally then, that is balanced with caution, because we've had many twists and turns with COVID-19. And as I said today, and as Taoiseach has said, this is not over. We will never be in a position to say that COVID-19 is eliminated. It's a virus we will have to live with. But what we have to do is try and mitigate it, and I think the vaccination has been a powerful weapon for us. I do not underestimate the virus at all. So it's one of sort of, I suppose, so far quiet satisfaction that we've managed to get to where we are today, and that we can progress further in the coming weeks. But equally, there will be an element of caution and concern also that this virus can return in a different format to undermine the best laid plans. I'm very conscious of that.
To say I'm looking forward to dancing again. I think if things go to plan, we'll have some of the best Halloween parties in Ireland in a few weeks' time. I'm no Michael Gove, but I do look forward to the dance floor once again. To answer your question, when it comes to pubs and restaurants and cafes, those Fall Child Ireland guidelines remain in place until October 22nd. So people are supposed to stay seated, and there isn't going to be dancing in pubs and restaurants and cafes. But the Taoiseach says we need to be practical too. The legal prohibition will be gone. There will be concerts in September, seated ones indoors and concerts outdoors, perhaps in parks. you know, we're not going to rebuke people if they do a bit of dancing. You know, let's be realistic. We're not going to say to people that, you know, if you're at a concert and you have to stay rigidly in your seat for the entire concert. And we're not going to say to people standing in Marley Park at the Phoenix Park that while you're watching your favourite band play that you must stay rigidly still. You know, we're moving away from regulation, if you like, to a more practical approach that isn't about rebuking people, but is about encouraging people to.
The Moon Tour won't be watching. You know?
No. Nor will the Doctor either.
Sorry?
Yeah.
Yeah.
Just for the Taoiseach, what month do you foresee the start of the booster campaign? Who will be targeted first for that? For the Taoiseach, if I may, you've been outspoken before about the role of NAFIT and the interplay with government. Obviously, the plan is to wind it down and move it to a different capacity at the end of October. Is it the right time to do that when you look at what's happening in Israel, and what's the thinking behind that? And then finally, if I may, a question for Minister Eamon Ryan. When do you foresee the removal of the requirement for the digital green cert to travel within the UK and the EU? Thanks.
Well, first of all, pending advice from NIAC in respect of the government is determined to bring in a booster programme, but the initial group will be immunosuppressed groups, then nursing home residents, and then healthcare settings. And that's the initial phase of the booster programme, but we have to await advice from NIAC in respect of that. Europe envisages and have already entered into pre-purchase agreement up to 800 million vaccines, 900 million vaccines over the next 2 years, with Pfizer and Moderna. So we will have our share of that. And so we'll obviously, there's new studies coming in respect of efficacy of the vaccines, not just in terms of infection, but also in terms of obviously impact on hospitalizations, ICU, in terms of the length of time, the length of the immunity that is given, and the length of protection, the protection that you get over a period of time. So I think that advice is coming in and will come into to NIAC and to our health authorities over the coming weeks. Yeah.
Just to say, you know, in relation to NEFIT, I think we're very fortunate that we had NEFIT, and I think we should be very grateful to the members of NEFIT for the work that they've done in the past 18 months. Most of the advice that they've given us has been right most of the time, and that's not easy in this kind of work. And we shouldn't forget that many members of NEFIT also have to do full-time jobs. You know, professor of a university, running a major laboratory, full-time GPs. You know, they had to do their day jobs as well as be members of NEFIT. And I think the entire of our society owes them an enormous debt of gratitude. And the fact that we didn't always see eye to eye or agree on everything didn't mean that we weren't always on the same side, and we always were. There isn't a date as such to wind down NEFIT, so you know, NEFIT will remain in place. A lot of people wouldn't know this. The current NEFIT is not the first NEFIT. We've had NEFITs in the past for other public health emergencies, and going back to the H1N1 pandemic as well, a very different pandemic. So I think NEFIT will be around for some months yet, and there isn't a date for this NEFIT to end. But it is intended that it'll revert to a more normal role, perhaps be slimmed down, and perhaps a less prominent, less public-facing role. But the last thing the government would want to do is dissolve the body that has given us such good advice and such reliable information for the last year and a half. So there isn't a date as such for that to happen.
Could I just maybe add to that? I think that the way to look at this essentially is we're transitioning into a new phase. Public health has always been central to how Ireland has approached this pandemic. And I think when public health is central to that endeavour, countries have generally done well. In countries where public health was relegated or undermined consistently by certain leaders, the performance of those countries was poor in terms of mortality, case numbers, hospitalizations, and so forth. So public health will still be central through the CMO and others. But the idea is then to transition, not just that, but vaccination task force, for example, would be transitioned into the National Immunisation Office and the HSE, the senior officials group, because within the public service, there's been an extraordinary effort put in with civil servants as well behind the scenes in terms of putting together the various plans and so on. And so it is important at some stage that we make that transition over time, but also to do it in a way that the added strengths we now have built up because of the pandemic are embedded into the system. So that in public health, for example, the commitment to double investment in public health, to move to consultants, led public health system and service, that now we have a much stronger public health capacity now, and will have. And that involves investment in genomic sequencing and in all of that. So all of that still remains. It's just that the context and how you transition it into sort of the more streamlined approach that normally applies to how government operates. That's the transition that's being outlined in the plan.
Part of that transition as well is we've a range of emergency legislation. When we introduced it, we said it was emergency, and they have sunset clauses, and as they are reached, for the legislation to lapse. Some may be slightly extended number of weeks, for example, to the 22nd of October as needs be in particular pieces of legislation. But the general approach is to remove all the restrictions, legal and others. NEFIT's advice was along similar lines, that in the autumn period we would see the end to the use of digital COVID certs, including for the likes of international travel. It's still an uncertain period. We have to be careful. As Taoiseach just said, even the advice today from European authorities regarding travel between the states, because in the states the numbers are skyrocketing. So it is one where we're still have to be careful and do phased changes. That will, I hope, I expect to include the use of antigen testing, which I think has a significant role in a whole variety of ways in terms of this safe return. But it's more likely later in the autumn, all going well, that those other transport or those other aviation transport measures will be removed, and we will return to the common travel area with the UK. That's in all our interests. Before them.
Taoiseach, you mentioned earlier about finding ways to commemorate those who lost their lives during COVID. Are there any suggestions that you've thought of, or is there anything in particular that you've that has been agreed on? And if something does drastically go wrong over the next, say, if something drastically goes wrong over the next 6 to 7, 8 weeks, if a new variant emerges or hospital numbers rise, does that mean the October 22nd date will be pushed back?
Yeah, if anything, as I said in my speech, and as we say in the plan, if a variant of concern, for example, emerges that's more highly transmissible and that penetrates the vaccine wall, that would cause a rethink and a reconsideration of that date and of strategy, quite frankly, because that would create a new situation that we'd have to respond to, and we won't be slow to respond to any new situations of that kind. In terms of memorialising those who've passed away, I think it's important that we would consult with people as well, and that's something that government will work on. It's in the programme for government that we would do this, and we will enter into a period of consultation as to the best way to remember those who have passed during COVID-19. Thank you. Sorry? To masks? Actually, I think we will continue to wear masks personally right through the winter period in certain settings, and I think we, as the Taoiseach just said earlier, they can be of great value in other areas. I have a sister-in-law in Singapore who was urging me since January to get the masks out and to start wearing them, and it's ritual there. It's not ritual; it's habitual. Sorry. And we can learn a lot from other societies in terms of how we combat respiratory diseases. So I think the mandatory one, we're saying that will remain on after the 22nd of October. Just factually, we don't have a date for when that would be removed. Obviously, the behaviour and incidence of the disease will determine that. But I think as individuals, I certainly would think the masks could be a feature in a voluntary way in the Irish winters of the future. Thank you all very much indeed. Thanks.
Thank you.